The Atayal village of Smangus in Hsinchu County is frequently referred to as God's village because of its breathtaking scenery. Hikers who flock to the area bring tourism dollars, but the area continues to lack many social welfare resources. For over 15 years, Mackay Memorial Hospital has helped bridge this gap through mobile clinics, but there is a concern that subsidies could run out, which could spell an end to these services. Our Sunday in-depth report.
The Atayal village of Smangus in Hsinchu's Jianshih Township is known to many as God's village. Located at an elevation of 1,500 meters, it is known for fresh air, abundant forests, and 1,000-year-old trees. Many hikers visit the area. Arriving at the village of Smangus is difficult. It requires a 3 to 4 hour drive on mountain roads that average less than 5 meters in width. Drivers face treacherous conditions the entire way. In December 2012, a minibus loaded with 23 people traveling to the village of Smangus tried to back up to make way for a passing vehicle. It ended up falling into the valley, leading to 13 deaths and 10 injuries.
When
we heard this news, it shocked the entire tribe. In less than half an hour, all members of the tribe were contributing to the rescue effort.
This was Taiwan's third worst tour bus accident. Smangus villagers were the first to respond.
If Mackay Memorial Hospital didn't give us some basic first aid training, we could have experienced even greater loss of life when the bus fell into the valley.
Residents pride themselves in their first aid training and how it helped reduce casualties. The accident highlights the troubles caused by this narrow mountain road, which makes ambulance access difficult.
I have a strong memory of a visitor who had heart problems while traveling on the giant tree trail. We sent some young people from the village to get him and bring him back, but we had no way to treat him. He died here.
This painful experience led the village elder to seek expanded mobile clinic services. From 2009, Mackay Memorial Hospital would not only send doctors to treat patients, but would also teach villagers basic CPR and disaster rescue. Elders and youths in the community now come together to learn first aid.
We recommend 2 breaths into the respiratory tract and then using the defibrillator. This is called CAB. It's a group activity that requires practice from each participant.
Mountainous tribes need to be equipped to immediately respond to injuries when facing serious disaster. This is especially important for Smangus.
After seat instructors have been trained and we have rescue training, at least when we do CPR, we can provide the person a chance to live.
But this rural area needs more than emergency medical care. It also lacks basic treatment for body aches and orthopedic examination, and work-related injuries and medical rehabilitation. Parents in plains areas can easily bring their children to a doctor when they have a fever or need a checkup. Those living in remote mountainous areas may only be given this opportunity once a year. Mackay Memorial Hospital has provided mobile medical services to Hsinchu's Jianshih Township for more than 15 years. Each year, it sends a large-scale medical team into the mountains. Demand for dental services is quite strong.
Many children suffer from serious tooth decay. Their remote location may be a reason why they cannot continue treatment.
Living far away from medical care means that many of these residents have to endure pain such as toothaches. It also means that they don't undertake routine medical checks for problems such as hepatitis B. Residents believe that as long as they feel fine, they are not sick.
In this mountainous village, most people pay little attention to health issues. If one is really sick, he or she will check the severity of the case and then decide whether to go down the mountain to seek medical care.
Comprehensive health checks are offered to villagers once a year. Then they don't need to travel far to get the care offered by Taiwan's national health insurance system. Unfortunately, mobilizing such medical manpower is expensive and requires a lot of work. If NHI cuts subsidies, Mackay Memorial Hospital could potentially end this service.
Actually, health insurance isn't limited by types of service. For the next stage, we will conduct medium-scale activities. They won't be as large as the actions which took place this year.
For 15 years, Mackay Memorial Hospital has cared for the people of this community. Policy changes could bring this fruitful partnership to an end.